as I said before, the regulations really emphasize a flexibility of approach to addressing, your circumstances. If you look at section 164.306b, that's where the language is that talks about that. And I think that the other theme is that you have to have effective disaster recovery planning, which means that you do risk assessments, you do planning, and you do practice and testing. Those are the key elements to making sure your DR plan is going to work and is going to work appropriately. Now, the process to develop a DR plan, I think, is a multi-step thing, and it's iterative. And what I mean by that is that you may implement a solution after doing appropriate planning and risk mitigation. And you test it and you realize that it's incomplete, or that you have a system that you really need to have in your DR plan, but you didn't consider it. So you may identify those changes, implement a new solution as a result, and go through testing again. Your system's environment changes all the time, and so there's a need for repetitive testing and for changes to your plan in order for it to be effective. So the process it really starts with a risk assessment, which identifies what your systems are. It identifies the risks that you have. It identifies the mitigations that you have in place today. And then it identifies for you what are the mitigations that are missing, or the gaps in your mitigation plan. Then you can develop a budget around doing a better job of mitigating for those risks that you hadn't considered before. That may require you to develop an RFP, which you send out to vendors that provide those sorts of mitigations. You review those responses, you figure out what you can fit into your budget, you contract with somebody, you implement it. And then you go through the documentation, testing, and change process with doing DR. It really does involve, when you do a risk assessment, a systematic evaluation of each system. So you can't do it haphazardly. You really have to look at everything. And the reason for that is that a lot of interoperability and a lot of shared risks exist between systems. So your electronic health record is dependent perhaps on a practice management system. You need to look at risks for both when you're evaluating either, because a loss of your practice management system's demographic database has a direct impact on your electronic health record, for example. Viruses attack all kinds of systems, and taking down part of your network or part of your workstations would have an impact on all of your systems. So it's important to look at that. It's also important that it be technical and it be detailed. So it really requires IT staff to sit down and think about risks, think about mitigations. It may involve administrative staff or other people that regularly use your systems that may point out certain risks that maybe you wouldn't consider otherwise. It's important that you go through and you do it regularly and you do it repeatedly. Risk assessment's not useful if you only do it once. Again, as your systems evolve and change, you need a risk assessment. Now, there's a number of methodologies out there. CMS has published one that was revised in 2005. It's a qualitative one that helps you categorize your risks, evaluate the potential damage and the likelihood, and then categorize the adjusted risk of that particular situation or risk. And you categorize things in that matrix to identify what's a medium or high, what's a sufficient enough risk to justify mitigation. It also helps you identify risks that may not be mitigated at all or that are insufficiently mitigated. And a DR plan is one of those sorts of mitigations that may come out of a risk assessment. Now, you can also do a quantitative method, which is you attach dollar values and a percentage chance of something being realized. You add up all of those calculated risks, and you say for this system you have X amount of quantitative risk. Therefore, I can only spend up to that amount, for reasonable mitigation. That's another way of doing it. They're equally valid. I would encourage you to pick one and try and work on one rather than doing several, but either is a valid way of doing it. Now, once you've developed your risk assessment and you've looked through and you've seen what you haven't mitigated sufficiently, you can develop a plan to mitigate those risks. And that may be where you develop a DR system implementation. But along the way, you're developing a document that says this is how we're going to respond to disasters. This is how we're going to be able to operate in emergency mode. And so you work through that and you develop that. And that may involve computer systems, it may involve other things. But it's also important when you're doing that and when you're developing your mitigation plan that you really think about how much disaster recovery your organization needs before you develop an RFP and you approach vendors and you do pricing and other things. You don't want to go too far. DR can be very, very expensive, and it may not make sense if you're a small organization, to have a hot site somewhere. It may just not be cost effective for your system. So you want to always take a step back, take a deep breath, and think, what's appropriate for my organization? Is this too much disaster recovery? When you're developing your plan. Now, once you've implemented your system, presumably you approach a vendor, you purchase a system, you purchase some hardware, you purchase some consulting time to implement it, like any other IT project. But once you've done that, you want to evaluate whether your DR plan has met your goals. And it's helpful at this point to do technical testing, but it's also helpful to do a tabletop exercise with technical and non-technical staff. And what a tabletop exercise does is it helps you facilitate a discussion around a table for a couple hours about different kinds of scenarios. And you discuss your operational issues, your technical considerations. You talk about, what's going to happen if X occurs, if a hurricane occurs and we lose power for 3 days. How are we going to operate? You can look at a more detailed document about tabletop exercises by the National Institutes of Standards and Technology, or NIST. Their special publication 884 talks about tabletop exercises in a lot of detail. It's very helpful. They're maybe a little bit overdoing it for some organizations. Is very complicated, their tabletop exercise. But I think sitting around a room with a facilitator to ask people questions to get them to start to think about, what's step 1, what's step 6, how do we get to, a live production system again, what are the issues that are going to come up, how are we going to address those things. That's the purpose of a tabletop exercise. And of course, the technical testing is also important. You want to make sure that your DR system is going to work appropriately. And if you're missing components, that you address that promptly with your vendor or with your internal IT staff. Technical testing is also helpful because it helps the IT staff build confidence in the DR system itself, and that they feel like they really understand how it works, so that in a real disaster, when the pressure's on, that they're prepared to just simply walk in and push the appropriate buttons to get things back up and running again. Now, in DR planning in general and in risk assessment planning, there may be risks that you just can't mitigate. There may be things that you just can't plan for, you just can't estimate what the risk would be, or you just aren't going to think about. And I don't want people to take away the thought that the HIPAA regulations require you to think of everything. It's a reasonable test. I think that it's also important for risks that you identify that you can't mitigate, that the leadership of the organization really accept those risks, that they understand that operating this business with these systems that we can't mitigate appropriately presents risks that we just have to deal with. Maybe there's some other insurance policy that you purchase, or maybe you just simply accept that, as the reality of the world. DR is also not a guarantee that you're going to be able to recover. So you go through all this planning. It's not a 100% guarantee that things are going to work right when you're done. But it is useful to improve the odds of recovering successfully. And I think that's really what all this is about, is dealing with the odds, walking in with eyes wide open, so you really understand what your risks are and how you can go about recovering successfully from them. And that's sort of an overview of how DR works within the Health Insurance Portability and Accountability Act.